Thank you so much for that really important discussion and so timely for many of us. Just a quick hello to our audience from me this morning. I'm Dr. Gina Lochner. I'm one of the sports medicine and lifestyle medicine specialists here at UC Davis with the Department of Physical Medicine and Rehabilitation. And it's been my honor to co-direct this Wellness Academy for 2024. We hope you're all enjoying this learning experience and really sharing with your friends and loved ones some of the important information that we've been able to bring to you from our UC Davis colleagues. Dr. Hostinar, thank you so much again for joining us. And we have a number of interesting questions following up your very important talk, so timely. I think everybody is feeling a collective rise in stress for a number of reasons. And perhaps the irony doesn't escape any of us that during times of stress, uncertainty is a really costly thing for us mentally and emotionally. And it does seem that things like social media and quick clicks are an easy way to try to help get information rapidly to sort of assuage our rising levels of stress and uncertainty. It's almost like the eating of junk food, even though we know it's not good for us, it's comforting at the time. Did you have any specific recommendations for us relative to online fact checker sources or specific places to go to look for information? You did mention the NIH and looking at published sources with randomized controlled trials. We had some questions about whether or not you had any additional patient-facing information that might be more easily accessible for people to digest and understand.
That's a great question. I often recommend, government websites like the CDC, the NIH, the World Health Organization. I wish there were more fact checkers in the health and wellness space. I think there are some fact checking websites in the political space that are quite good. Like Snopes and others and NPR, but I think in the health and wellness space, I think we could benefit from more fact checkers. And I would say, you can also follow specific experts. If you find that there is an expert in adolescent development who is part of the National Academy of Sciences that you came across, that might be somebody you might want to follow. And you could look at their, news interviews on YouTube, or you could look at their page, you could look to see if they have a book. So you could find specific experts on specific topics who have both the training in that area and they seem to have received a lot of recognition from their peers. So those would be some of my recommendations. But I do think we need more such websites and organizations in this space. I wouldn't, there isn't really a great one that has very accessible information on wellness right now, for example, other than the Office for Wellness Education, of course. So I think there's room for, many of you or many of us to start building some of this infrastructure that's tailored to wellness.
Yeah, thank you. Related to that, AI is becoming more and more a part of our lives, as we know, and we have varying levels of engagement with it as a whole. How trusted do you think that will be as a resource in terms of its ongoing accuracy and efforts at improving information that people can get? It's part of our search engine option at this point. What are your thoughts on AI specifically as it relates to communicating some of this health and wellness information?
I talk to colleagues in computer science and engineering who are very excited about AI, its potential to learn vast amounts of information. And I see how excited they are, but I also talk to public health experts who are extremely concerned about the blatant inaccuracies that emerge in these AI summaries or AI searches. And I think it's so new that a lot of people who encounter it are not yet aware that it does not have access to fact checking, to reality, to peer-reviewed scientific information. It is simply oftentimes these algorithms are simply averages or aggregates of what they can find online or what they've been trained on, which could include high quality information or not, or low quality information. So my current stance is one of skepticism. Um, I think it does better. AI does better with automating tasks that would take us a long time to do. um, to help us search for something, you know, or to alphabetize a list or put in reverse chronological order. I think it does well with things like that. I don't think it does well with summarizing scientific information. But I also recognize this may change over the next 10, 20, 30 years as they start to train AI on scientific information. I would say right now, I would not trust it. But this might change, 20, 30 years from now if they're able to find a way to get a human in the loop, or if they find a way to curate the quality of the information that goes into the training.
Thank you, Dr. Hostinar. We really appreciate your perspective from a research standpoint and also your very, very helpful information on combating health care and wellness misinformation. Thank you so much for joining us.
Thank you. I appreciate it. It was a great honor to be asked to speak. And I hope this is helpful for those of you who are bombarded with misinformation on a day-to-day basis, but also who might be sort of interested in what you can do to make a difference in this space.
Thank you so much.